Hi, I'm Chris Sepper. I run MedCityNews.com, and we're here at the conclusion of MedCity ENGAGE, which is MedCity News' patient engagement conference. This year we did something different. We had a challenge where we offered 3 teams a chance to answer some of the biggest issues in patient engagement and come up with great solutions. And I'm actually sitting here with the winner, Tony Pashley, who is the Vice President of Product at Sharecare. Team Sharecare actually blew away our audience and was the winner of our competition. Great. Tony, congratulations.
Yeah, thank you, Chris.
Thank you. So, all right, what we wanted to do this year, I want to explain what we wanted to do, and then, Tony, I want you to talk about what you came up with. We've got to make patient engagement solutions last beyond just a couple days at a conference, and so we tasked Sharecare, Lumiata, and Kindred Healthcare with different challenges. There was innovations in patient engagement, there was health data stories, and there was engagement-rich messaging. And we asked these teams to come up with their idea of how we could help advance these causes, all under the rubric of patient engagement. They went and they spent the first day working on their solution, and they came and presented to the entire MedCity ENGAGE audience the solution to their problem, and they all voted on it. So, Tony, tell us, and I should say this too, now as the winner, MedCity News reporters are going to explore the ideas that we came up with here at the conference, because like we said, we really want to keep the conversation on patient engagement solutions going. So Tony, you were best in class. Talk about what happened in that room, and then what you came up with.
Yeah, so we had the full workshop yesterday, and it was really energetic, lots of contributions. I think the most fascinating part about it was that everybody had a different perspective. So we had doctors in the room, we had health professionals in the room, researchers. So everybody came at it with a different angle or a different sort of idea in their thinking. So what we did was we got together, we talked about sort of the problems today. So the problems in the system when it comes to prescriptive health actions. So a doctor may tell you, hey, you're pre-diabetic. What happens after that? Where are all the breakdowns in the system? So we looked at that, and then we started to brainstorm as a team. What could be some innovative ideas at those moments in time when a patient, just a regular person like you and me, really needs help in the healthcare system? So we came up with 5 big ideas at the end of it. One was around when somebody is told by the doctor, hey, you need to start working out, you need to go exercise. What if the doctor actually gave them a prescription that said, here's a free gym membership, and the first 10 pounds is free. Mm-hmm. So you can go there, and until you lose 10 pounds, you don't have to pay a dime. So just sort of the incentive and motivation to get people working. And then also there was another idea, a lot of ideas around nutrition, which were really fascinating. One was around, so let's say you have been diagnosed pre-diabetic and you're at the grocery store. How do you make those tough decisions about what you should purchase, what you shouldn't purchase? An idea came out about just taking a photograph of your shopping cart and maybe sending that to someone and getting some advice, some recommendations. A couple other quick ones. One was around, this is a really important one, because when patients are sitting with the doctor, sometimes they're told sort of their diagnosis, and then they just shut down. They're not listening. They're not even understanding what the doctor is saying to them. So what if there was a way to just bring someone else into the conversation? Someone to act more as a coach to help them understand, to have the right information when they leave the doctor visit. Because right now there's over 50% of people who sit with the doctor can't even remember what the doctor said during the visit. So we need to make sure that we empower patients, that we give them the right information so they can take the next steps and then stay engaged, right? That's the big one, is how do we give them the motivation, the right thinking, the right tools to help them out along their journey.
It's interesting, in MedCity conferences like ENGAGE are always kind of a collection of the ecosystem. One of the big challenges has been to break down silos. Was it difficult to get all your different kind of constituents? You had people from pharma, you had people from tech, payers, right, providers. Did you get them all on the same page? How long did that take?
You know what, that's a great question. My colleague Bella Martin and I were just talking about this after the workshop. It took a little while. Everybody has to sort of warm up and say, you have to get them out of their comfort zone. You have to get them sort of thinking, okay, that doesn't exist today, but that's okay. What if we did it? What are the problems with that? So it did take a little while, but I think we got there.
Now, talk about Sharecare a little bit. I know most people are probably familiar, but tell us more about Sharecare and share your philosophy on engagement overall.
Right. So Sharecare is a company that's founded on the philosophy of helping people live their healthiest life. So we're a free platform. We're out there for patients to join, to find other people to share information with. So we just saw Susanna Fox talk about home hacks. So this is a place where people can post those home hacks and they can share that information to help inform and maybe help someone else like themselves. We also have physicians on our platform, and so you can actually connect with a physician, maybe find one in your local area to make an appointment with, and then have some post follow-up from that visit to actually communicate with them. So we're at a really exciting stage. We're really looking for that patient engagement and getting those patients in, finding out what are the things that they need, right? So we focus really on the consumer and designing for the user, and that's really our philosophy, is making sure that we listen to the problems that exist today and we solve for those.
Well, you know, it's been an amazing day, and I know it's been an amazing couple days. So I just want to thank you for coming up for these ideas. Like we said, you know, you're going to be able to see the presentation they made here at Engage. You're going to be able to learn more about what they've done. And over the next few months, we're going to take some of those big ideas that came out of their project, and we're going to solve those problems, and we're going to explore them on MedCity News so we can all participate in making patient engagement a better experience. So for Sharecare, for everybody that attended MedCity Engage, I'm Chris Sepper. Thank you very much for watching these. Thank you. Congratulations.
Thank you.